Okay, if the variability is less, it indicates fetal hypoxia. So one we see is fetal heart rate, where 10 minutes we see into consideration and decide. Next is baseline variability. Sinusoidal heart wave pattern indicates fetal anemia that could be due to parvovirus B19, RH incompatibility, vasa previa, severe hypoxia and acidosis, sinusoidal heart wave pattern. And we manage this by immediate C-section. Fetal heart rate acceleration. Increase in fetal heart rate by 15 beats per minute for 15 seconds with fetal movements. So fetal heart rate acceleration is increase in fetal heart rate by 15 beats per minute for 15 seconds with movements. So normal fetus, this will be there. In compromised fetus, there is normal fetal heart rate, but there is no acceleration. That is compromised. If NST is done between 30 to 31 weeks, fetal heart rate increase by 10 with fetal, 10 by 10 kansate. Causes of absent acceleration is fetal sleep irbodu, that is okay. Fetal hypoxia, narcotic use, fetal acidosis, sepsis, all these are the causes for absent acceleration. So what do you do for this? Pregnant women with decreased fetal movements, you do NST for 20 minutes. If there is more than 2 accelerations in 20 minutes, it indicates it's a normal fetus, so no need to worry. But if the acceleration is less than 2 in 20 minutes, we repeat the NST for 20 minutes extra. Okay, that time also there is less than 2 accelerations, 40 minutes, it is definitely a compromised fetus. So it could be fetal acidosis, sepsis, sleep, prematurity, all of that. Biophysical score, we will calculate, that is diagnostic. So NST predicts the fetal status for upcoming 1 week, done weekly. At the 1 week varagu it is valid. It can be done twice weekly or daily also. NST cannot predict sudden onset events. Sudden NST cannot predict it, like cord prolapse, abruptio placenta. Okay. Reactive NST 99.5% accuracy of predicting well oxygenated fetus. Non-reactive NST predicts fetal hypoxia only in 50% cases. Biophysical score or Manning score is a scanning which is a diagnostic test. It is done over 30 minutes and each parameter is assessed. TB meningitis is always naughty. So T is for tone, B is breathing movements, M is gross body movement, A is amniotic fluid and N is NST. So tone, body movement, gross body movement, breathing movement, but A in the amniotic fluid and NST. Fetal tone, more than 1 episode of extension and flexion. Fetal tone, more than 1 episode of extension and flexion. Fetal breathing movement, more than 1 episode of breathing movement for more than 30 seconds. 30 seconds will extend aveko. Gross body movement, more than 3 body movements for 30 minutes. More than 3 baratte. Amniotic fluid, single deepest pocket, vertical more than 2 cm. NST is reactive. So fetal tone, TB meningitis, tone more than 1 episode of extension flexion, fetal breathing movement more than 30 seconds, gross body movement more than 3 in 30 minutes, amniotic fluid more than 2 cm, NST reactive. So biophysical score correlates to fetal pH. If less biophysical score, it indicates fetal acidemia. In fetal hypoxia, the first parameter affected is NST and the last parameter affected is fetal tone. The first parameter to be affected is NST. The last affected is fetal tone in fetal hypoxia. Okay. So how do you manage for the scores? So if the score is 10 on 10 or 8 on 10 with normal amniotic fluid volume, then just reassurance is the management. Decreased risk of fetal hypoxia. Okay. If the score is 8 on 10 with normal amniotic fluid based on the period of gestation, more than or equal to 37 weeks, Mandri deliver. Less than 37 weeks, repeat in 24 hours. 8 on 10 or 6 on 10 with decreased amniotic fluid, suspect hypoxia. 4 on 10, delivery done if a period of gestation is more than or equal to 32 weeks. 2 on 10 or 0 on 3, immediate delivery once big. Other methods are vibroacoustic stimulation test and the contraction stress test, modified by physical score takes 2 parameters, NST along with amniotic fluid index.